Good afternoon, my name is Ricardo Zurita and I'm going to talk about acetaminophen versus ibuprofen in young children with mild persistent asthma. Well, definition. Asthma is a chronic lung disease that inflames and narrows the airways. Asthma causes recurrent periods of wheezing, a whistling sound when you breathe, chest tightness, shortness of breath, and coughing. The coughing often occurs at night or early in the morning.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing.
Well, applications in medicine. Many children younger than 12 years of age receive acetaminophen each week, making it most commonly used pediatric medication in the United States. Observational data from both pediatric and adult cohorts have suggested an association between acetaminophen use and concurrent asthma and symptoms, and decreased lung function. Furthermore, a post-hoc analysis of a randomized trial of the safety of short-term use of acetaminophen versus ibuprofen for febrile illnesses in children similarly showed that the relative risk of unscheduled visits for asthma after the use of acetaminophen was substantially higher than the risk after the use of ibuprofen.
It's an age-old question, ibuprofen or acetaminophen, and what's the difference anyways? Hey guys, Julia here for D-News. I got a migraine recently and I popped a few ibuprofen and felt so much better. But that made me wonder, how do major pain relievers actually reduce pain? Well, there are special receptors in your body that respond specifically to pain called nociceptors. They protect us by responding to potentially damaging stimuli like a burn or a cut and send a signal fast to the brain. Once your brain gets the signal, ouch, this hurts, your body is already going to work to heal the wound. Most injuries get hot and swollen, but this is your body trying to protect itself. By swelling, the body might prevent further injury by immobilizing, say, a joint or whatever, and the heat might be the result of increased blood flow or it might cause increased blood flow, which means more healing immune cells get to the point of injury. Another thing injured cells release is arachidonic acid. The two enzymes, COX-1 and COX-2, react with this acid to produce prostaglandins. These can create other chemicals which are responsible for all that swelling, heat, and pain. And this seems to be the target mechanism of non-steroidal anti-inflammatory drugs like ibuprofen. Ibuprofen was discovered in the 1960s and in 1983 was made available over the counter. It's originally designed to be an anti-inflammatory drug. It works by stopping the production of prostaglandins by blocking one of the active sites of COX-1 and COX-2.
Well, in pros and cons, acetaminophen and ibuprofen both fight fever, but ibuprofen better for fever studies suggests. Both eases pain, but acetaminophen is better for headache and arthritis, while ibuprofen better for menstrual cramps. Both soothes sore throats, both eases inflammation, and both are easy on the wallet. Ibuprofen is better for sinusitis, backache, muscle soreness, earache, and toothache. Well, both have toxicity. Acetaminophen is taken too much at once can damage your liver perhaps permanently, while ibuprofen prolonged use can lead to kidney damage, heart attack, and stroke. The side effects of the acetaminophen minimal except for rare potentially fatal skin reactions. Seek help promptly for rash or blisters, while ibuprofen severe stomach bleeding, ulcers, heartburn, GI upset, gastrointestinal upset, and constipation. Hidden dangers in more than 150 cough and cold, allergy, pain, sleep, and other products. Check all labels for acetaminophen or APAP. While in ibuprofen, avoid before and after heart surgery. Do not use if you're allergic to aspirin, naproxen, or other non-steroidal anti-inflammatory drugs. Well, in conclusion of this study is that over the 1 year study period, we did not find that asthma exacerbations or other markers of asthma-related complications occurred more frequently among children who were randomly assigned to receive acetaminophen than among those who were randomly assigned to receive ibuprofen. Thank you.